The old slogan, "Time is brain," is still true. So it's all about time management. Time management meaning from beginning of the diagnosis of the suspicion uh, to hospital transport and also the logistics in the hospital. That means that we want to get a real quick imaging, and if there is a large vessel occlusion, which typically is the reason for a major ischemic stroke, then the patient should be taken immediately to the angio suite. The stroke patient can be a very silent patient. So he just has some focal neurological deficit. It's not painful. He just cannot move half of his body. He neglects half of his body. So it doesn't appear clinically, it doesn't appear so dramatically. And therefore, maybe all those who are involved with stroke treatment may underestimate the urgency of this disease. However, it's improving, and all the structures and all the networks which are built up in all countries, they are really focusing on increased quality of, or maybe increased speed of patient transport, and bringing the patient to adequate treatment. However, you have to educate all the team, all members of the team. It's not only up to the physicians, of course. It's all of those who handle the patients. It's the patient transportation system. You have to be really, you have to tell these patients, please move the patient quickly from room A to room B. It's all about the technologists who may prepare the table. They have to know that it is really urgent, and you easily can lose half an hour, 1 hour during all these processes. Clear yes for CT angio. Of course, you can use also MR, MRA. However, CT is the procedure, the imaging procedure, which should be used first in most centers. Again, it depends on the circumstances, on the local circumstances. Some really highly specialized centers, they might have an MR equipment available 24/7. This is not the case in most centers. So CT is a really robust technology and a methodology. You get all the information you need with a scanning time of a maximum, let's say, 45 to 60 seconds. And this, again, this already includes CT perfusion. So CT, CTA, and if available, CT perfusion definitely is the diagnostic method of choice. Well, the current evidence is based on numerous trials, the big 5 trials, all randomized trials, which came to the conclusion that endovascular thrombectomy is superior to systemic thrombolysis in patients with acute ischemic stroke. And these studies were followed by meta-analysis, by subgroup analysis, by new studies, and so there is no doubt that endovascular treatment is the method of choice for patients with large vessel occlusions. For instance, we know that that the so-called first pass thrombectomy, successful first pass thrombectomy, is one of the very important goals we should go for. The meaning that we go up with a catheter, do one aspiration, do one thrombectomy, and that's it, and get out all the thrombus. However, we all know that this is not always the case. So we have to work on improving our technique, improving our devices to get better in this sense, meaning that we have more patients with first pass effect, have more patients who will benefit from from our treatment.